So I've got my orders at 9 a.m. We're going to be administering 5,000 units of heparin and 50 milligrams of Demerol, which would be in 2 milliliters. So I'm going to go to the med room and I will gel in on the way there just for sanitary purposes, and then I can see what we're supposed to be doing. So that's my first check, and we're going to go ahead and get those things going. So I'll go ahead and grab some gloves. And we're gonna go ahead and come right over here. And this will be our Demerol, that will be our heparin. And we're gonna go ahead, since these are multi-use containers, we're gonna go ahead and clean the top for 30 seconds. All right, 30 seconds goes by, Demerol's clean. And we'll do the other one, in a second actually. So I'm gonna go ahead and get my Demerol. So I'll be using a dull needle and a 3 milliliter syringe. Screw that in, pop off the top. We're going to go ahead and suction down 2 milliliters without touching the stem of the syringe. Puncture the top, push the air in, invert, no luck, it's not coming out on its own, so we're going to go ahead and suck it up. That's a nice draw. 2 milliliters, tiny bit of air. Alright.
There's like other ones
22 gauge, 1.5 inch, and these are actually the appropriate ones, which are the
Either way, I still
25 gauge 1 inch. So I don't know if you
Looks good. We'll go ahead and recap that, and we'll go ahead and get our Demerol needle on, which is going to be a 1 inch 25 gauge. And that is now ready for our use. Now we'll go ahead and get the heparin ready, and we're doing 1 milliliter, which is 5,000 units. 30 seconds goes by. And we'll go ahead and grab our 1 milliliter syringe. And we'll grab a dull needle.
One of them was 5/8 inch. I think it was supposed to be Brennan.
There we go.
Oh, I see.
We'll go ahead and take out a milliliter's worth of air.
Yeah, I was just like, oh, okay.
Push a milliliter's worth of air in, and then take a milliliter out.
the diameter of it, and 1 to 1.5 inches depending on the size of your patient. You've got a really tiny little person, 1.5 inches. 1 inch.
Good. Just a couple champagne bubbles, everything looks good there. Put this in there.
Here's gauze.
And then we're going to be using a 5/8 inch 25 gauge needle
Yeah.
for our heparin shot. So we'll get that in. These 2 dull needles go in the sharps container. And now I'm double checking once again. We have our heparin, 1 milliliter. We have 2 milliliters of Demerol, and we are ready to go into the patient's room. All right, so I will be coming in the patient's room with my equipment. I will gel in, and I go knock, knock, knock. Good morning, sir. It's 9 o'clock, and we're here. I'm here. My name is Carmel to give you your Demerol and your heparin. Could I have you verify your name and date of birth, please?
Yeah, my name is Anthony. My card 0973-1994.
Awesome. And Anthony, do you have any known medication allergies or other pertinent allergies?
No known allergies.
Awesome. I'm great to hear that. So we've got 2 shots for you today. We're going to go ahead and administer Demerol first. Are you in any pain right now?
I'm in slight pain, about a 4 out of 10.
Awesome. Okay. Well, not awesome, but okay. So this is here, and this should be helping you with that pain.
All right.
So I'm going to go ahead and glove up, and then I'll be showing you a couple different spots that we can go ahead and give you this injection, okay?
All right.
So let me go ahead and raise the bed to a good working height for me.
Oh yeah, but you don't want
And we'll get going,
Yeah,
okay?
you want
Sounds
this?
good.
You got the needle?
No, I can.
Alright, so the first injection site we can do is if we find the acromion process right over here. We can go 2 to 3 inches down. This triangular area right here, our deltoid, that's one spot. If I could have you roll towards me, Anthony, we can also go ahead and place our hand right here on the greater trochanter, point our pointer finger towards the anterior superior iliac crest, and the right hand, or no, the middle finger towards the iliac crest, or this is actually the anterior superior iliac spine. Right here is another good spot that we can go ahead and give an injection. And then the last part with the greater trochanter right here, and we go ahead and find the knee. Between our thumbs right here in the middle, the vastus lateralis is a good tissue that we can go ahead and administer. And we're gonna go ahead and choose that spot. So, we're gonna be doing a Z-tract injection here.
All right.
And let me go ahead and just clean off that spot.
Right now, and I'm just getting all my medication.
So we're starting concentric circles, starting in, making our way out and around, nice and clean. We'll wait for that to dry. We'll get our Demerol, and I've checked that against, once again, in the room to make sure this is the correct dose, which is 2 milliliters or 50 milligrams. And this is an intramuscular injection. So we'll go ahead and pop this off.
My name's Madison. I'm just gonna be your
For the purposes of the video, we'll be squirting this out.
wristband. Okay. Lifter, can you state your name and date of birth?
Alright. And what we're going to be doing is I'm going to be taking my,
I'm just gonna recheck the migraines that I did earlier. So again,
taking my hand,
that's medication.
pulling skin to the side.
Time.
I will then grab my needle,
All that again.
bevel up.
What we're gonna do is
I'm going to go ahead and
your muscles for
puncture
pain. It's gonna be called
right there. I will stabilize with this hand and then go ahead and administer all the medication. Then remove the needle. I would flip the safety up, but for the purposes of this video, I'm going to go ahead and place it into the cap. We're all good there. And then I will remove this hand, keeping the skin intact there. Alrighty. For this injection, I'm going to go ahead and place a little band-aid over it.
All right.
And then we'll do it for just in case there's any blood. Alright, perfect. So we'll leave that there, tape it down. Alright, so next we have your heparin shot.
All right.
So for this one, we're going to do it right here in your stomach. And we're going to go ahead and give you 1 milliliter, okay? So this is an anticoagulant or a blood thinner, just to make sure you're not clotting it at all while you're here, okay? So once again, for the purposes of the video, we're going to go ahead and remove all the liquid.
Syringe, and I am going to use a 22 gauge and 1.5 inch needle. Then my other medication is going to be our heparin.
Alright, so I'm going to go ahead and
And this is
clean this area off as well. Concentric circles, starting small, going big.
and I'm going to use a 1
And then I will go ahead and get my needle nice and loose, get it nice and close to me. We're going to pinch,
needle for that. I'm going to set them
bevel up. We're going to go in at a 45-degree angle,
start with this whole process. I'm going to first start
administer all the medication.
with my medication vial.
I would flip this up, but once again, we're going to try to save a needle here. Save the equipment
In real life, you would do this for 30 seconds.
so I can use it again. And that's all good. Awesome,
Alright.
Anthony. Alright, let me go ahead and just clean off my table really quickly.
What cannula?
And is everything feeling okay? Nothing was too uncomfortable for you today?
No, everything was good.
Glad to hear that, man. Is there anything I can be doing for you before I head out?
No, I'm all good.
You're all good? Alright, so you got your call light there. I'm going to go ahead and lower the bed. Has the food been okay? You're eating all right?
Yeah, everything's good.
Alright. Well, we'll go ahead and say goodbye for now. If you need me at all, Anthony, the call light is right over there.
Sounds
And
good.
then I will go ahead really quickly on the computer, document that the administration's been given. I will gel out.
2 milliliters of air.